So what are the 10 essentials of public health? They are, this is essentially what it is. And this is a framework that was put forth by the CDC. And it essentially said that public health is made up of 10 basic things, all right? And those 10 things are broken out into 3 categories. The first is assessment. The second is sort of policy development elements. And the third is assurance, okay? In assessments, one of the main things that public health does is it monitors health. So in public health, we do a lot of tracking to see whether or not new diseases are popping up, or there's some sort of health issue that's coming up that we need to address in health. Or maybe there's a disease that we know about that's sort of increasing for some reason or another that we need to pay attention to, right? We also do a lot of work to say, okay, what is causing the most harm? What are the big hitters here that we need to address, okay? Then there's the assessment phase, which is diagnosis and investigation, all right? So here we say, okay, there's a problem. How do we figure out what's happening, right? What's causing this new disease, right? What are the sources of this? And we need to investigate that to sometimes figure that out, how that's occurring, okay? So once you have some information about what a disease is and how it's occurring, then you can get into that policy development phase, which is saying, well, we need to tell people about this new disease. We need to educate them, give them information about it, how they can prevent it, and help empower them to help themselves and their community, right? So sometimes that means giving them the resources that they need to do this. Another thing is mobilizing community partnerships. So public health, very often we work with organizations, we work with communities to talk to people about, okay, given this issue, COVID-19 or cardiovascular disease or whatever it happens to be, here's the things that we can do together to actually help take care of our communities, right? And then we can also develop policies. Like sometimes what we do in public health is we actually create policies that tell us, how we should do things in a clear sort of way. And that can happen at a governmental level, but that also happens in our colleges and communities. For example, UW-Bothell has a policy around COVID that says we're not going to do in-person classes, and that's our policy that we have as a school. It's also now a policy at a state level, but we actually made that policy early on. So you can have it at a local level as well. The last 4 components are called assurance. And assurance is essentially the things that we do in public health that make sure that health is maintained over time, okay? So what we can do here is we can enforce laws. So if we have policies or laws that come out, we can actually enforce them. So when seatbelt laws first came out, people kind of ignored them. It wasn't until they started enforcing seatbelt laws that people started wearing seatbelts, right? So there is the idea of enforcement in public health, which is kind of interesting because we also talk a little bit about some of the public health challenges of how we enforce things and discriminatory impacts of that, right? So there is other sides to that as well. There is linking to and providing care. So one of the main issues that we have in public health is that it's that populations or people don't have access to the healthcare that they need, right? So a major role and responsibility of public health is to help people to actually get the healthcare that they need in an appropriate and timely way so that they can take care of their problems. Connected to this is the next one, which is assure a competent workforce, all right? And what this means essentially is that we need to make sure that the people who are providing this healthcare actually have the training and skills and competencies that they need to actually effectively treat and take care of their patients or clients or people who have needs in their population. And then the final of the 9 that make up the outside circle is evaluate. So you also want to, in this process, be evaluating these projects, evaluating how these laws are working, evaluating these policies, evaluating the community partnerships and the monitoring to make sure that we're doing it well. Now that evaluation sometimes can give us insight. So evaluation can come tell us new things that we need to monitor or better ways to mobilize communities or things like that. So that's very important. These different factors actually interact with each other a whole lot. Then we also have sort of in the center circle, we see systems management that sort of connects across all these, and that's sort of connecting these different factors. And in the very center, we have research. So the reason that the center is research is that research, getting new information about health, is a key component to actually making this whole cycle work. We have to do research, we have to get data and information and strategies to help us to do any of those elements well. So that's the research side to the 10 essentials. So that's the outline of the 10 essentials of public health.